Hello everyone. Today I'm going to talk about an important herb, over-the-counter drug, dietary supplement, St. John's Wort. St. John's Wort is derived from a yellow flowering plant which is commonly indicated for or taken for depression, anxiety, and sometimes even as an oral analgesic, a topical antiseptic, or a wound healer. The NCLEX favorite is the drug interaction part of St. John's Wort. St. John's Wort, if combined with SSRI, that is selective serotonin reuptake inhibitor, SNRI, which stands for serotonin norepinephrine reuptake inhibitor, antidepressants, amphetamine, cocaine, or tramadol, if combined with St. John's Wort, it can cause serotonin syndrome, which is a life-threatening complication which can present with altered mental status from confusion, agitation to delirium. It can present with autonomic hyperactivity and neuromuscular abnormalities. So it should never be combined with these drugs. So it is very important to take proper history, ask the patient if he or she is taking any over-the-counter drug, and if they're taking St. John's Wort, it should be stopped before prescribing these medications. Other drug interactions include it can decrease the effectiveness of oral contraceptives. So again, this could be in the form of a question where a patient taking over-the-counter supplements St. John's Wort for anxiety and now presents with accidental pregnancy. So he or she should be advised to take alternative contraceptive measures. It can also induce the CYP450 enzyme and thereby decrease the effectiveness of key important drugs such as digoxin, warfarin, anti-cancer drug, antiretroviral drugs, anti-seizure drugs, steroids, cyclosporin, and calcium channel blocker. Again, these are drugs which are used for specific chronic illness, and therefore we don't want its effectiveness to be decreased because some of these drugs are narrow spectrum, have a narrow therapeutic index, and therefore the patient should be advised to stop the medication before taking these drugs. So patient education is important, and also what they should be informed about the serious complications of serotonin syndrome, and they should report to the provider in case it develops. Common adverse effects include sun sensitivity, so avoid direct sun exposure, apply a sunblock cream. Other less commonly asked adverse effects include dry mouth, constipation, or skin rash. Thank you.